One thing that really has drawn me to radiology is we learn a lot of the science behind the medicine. We're able to see a lot of the science in the pictures that we acquire, and we're able to translate a lot of our medical knowledge to a lot of different patients. If we're talking about unsung heroes, we are oftentimes in the background influencing the decisions. We have a very positive impact on patient care, but we're not always the ones there that see the outcomes.
Welcome to Mount Sinai Radiology. My name is Neil Rofsky, and I am honored to serve as the system chair of our department, a dynamic and innovative environment where expertise, curiosity, and clinical excellence crystallize to train the next generation of radiologists.
Sinai is a really strong program that blends a lot of the aspects of radiology that excite me.
The Diagnostic Radiology Residency Program at Mount Sinai prepares the next generation of radiologists for outstanding and rewarding careers as clinical consultants and as educators in both academic and community settings.
If you want to see routine outpatient cases, we're able to get that here. If you want to see patients with rare diseases being treated by specialists, we see that here. And then the final piece of the puzzle on it is that we have a strong academic program, and I'm really able to engage in a lot of the research that interests me, which happens to be in nuclear medicine.
Our commitment to medical education is clear. We're consistently top-ranked for residency training in national rankings.
It's 4 years of training. The first year of radiology residency has a huge learning curve, such that you're trying to understand images for the first time, you're rotating in all the different sections, you're picking up a head CT, you're picking up a chest x-ray.
Our radiology residents are highly motivated and involved in projects in all subspecialties, including abdominal imaging, neuroimaging, interventional, cardiothoracic, MSK, and pediatric imaging, as well as informatics.
The second year of radiology residency is when you start forming the understanding of disease processes, knowing how to diagnose certain conditions. The third year of radiology residency is really honing in on picking up the more subtle diseases. And then the fourth year of radiology residency, you're kind of rounding out your skills as a general radiologist while starting to form a subspecialty interest.
With over 80 years of experience delivering outstanding patient-centered care, our department spans multiple sites across the city and tri-state area. That means you'll see a wide variety of cases, from the everyday to the incredibly complex.
We have the complex studies that are typically reserved for the fellows. People go to fellowship to learn how to read body MRI, yet here at Sinai we get that throughout all of residency. We have such a strong foundation before we go to our fellowship or before we go to our practice that it really sets us up for success.
As a trainee here, you'll find yourself in a culture that truly values learning, mentorship, and teamwork.
One of the strengths of our residency here at Mount Sinai is we get to know our attendings very well.
You'll work side by side with faculty who are not only leaders in their fields, but also deeply committed to helping you grow and succeed.
You always feel like the attendings have your back. Whenever you make a mistake, you feel uplifted.
The residency program is committed to the growth and the wellness of each individual resident, to work with and to support each resident as they develop into the clinical and academic radiologists of the future.
Sinai really just has a lot of freedom for its residents to carve their own path from the beginning. One thing that really drew me to Sinai was we have a very strong nuclear medicine department. And I know that I have an interest in both radiology and nuclear medicine. And Sinai is one of the largest centers. They really give us a lot of freedom to make choices that we think are in our best interest, and I don't think that's true everywhere.
You'll graduate fully prepared to lead in delivering innovative, accurate, high-impact care that truly makes a difference. We look forward to meeting you on video or in person.